Muskegon Community College, and I was just wondering if I could come in and do your physical assessment today.
Yes.
Good. Okay, so would you start by telling me your name and date of birth?
My name is Ayana and my birthday is February 12th.
Okay, so you're about 14 years old?
Yes.
Okay, good. Alright, so I'm going to first start out by taking your vital signs, and normal vital signs are the temperature is normally 97.8 to 99.1, and heart rate is 60 to 100 beats, and respirations are 12 to 20 beats per minute, and the blood pressure is 90 over 60 to 120 over 80, and oxygen level is 95% to 100%. So Ayana's mom has told me previously that Ayana weighs 155 pounds and that she's 5 foot 2 inches. So according to the CDC growth chart, that Ayana, for her height, Ayana is in the 95th percentile, which is slightly below but still within normal range, and that her weight is 92 to 95th percentile, and that her BMI is 28.3 kilograms, and according to the CDC, Ayana is slightly obese, but we won't worry about that right now. We don't think that that's a concern for her at all, so we just had to throw that in there. So I'm going to, I'm just looking Ayana over, just her general overall appearance, and I'm going to take Ayana's respirations right now. So Ayana, if you could just breathe normally, and I'm going to time you for 30 seconds, okay? Just breathe in and out like you normally would. Okay, Ayana's respirations are 14 beats per minute, so now I'm going to take an apical pause for 1 full minute. Ayana's heart rate is 88 beats per minute. So now I'm just doing a general appearance, and I'm going to start by assessing Ayana's head. Just looking her over, checking for symmetry, checking to see if there's any lesions or any drainage anywhere, any bruises or blood or anything like that. So now, Ayana, if you don't mind, I'm going to palpate your scalp and just kind of touch around and feel in your head. Does anything hurt? Is anything sore while I'm doing this?
No.
Okay, good. Okay, so now, since I've assessed her head and palpated everything for her head, I'm going to move down to Ayana's eyes. I'm just going to check to see if her eyes are symmetrical on both sides, and if her eyeballs react to light. So I'm just going to assess your eyeballs, so you can just look directly at me. So now I'm assessing Ayana's pupils, and they both are equal, and they both are round, and they to like and accommodation at the same time. So now I'm going to assess Ayana's ears, checking for drainage, any swelling, checking for symmetry on both sides. I'm going to pull Ayana's pinna up and back to check for drainage. Thank you. Alright, thank you. So now I'm going to assess Ayana's nose, check it up in her nares, make sure they're moist. Looks good, no blood, no drainage anywhere. Alright, so now I'm going to assess Ayana's throat. Using my pen light, I'm just checking to see her mucous membranes look very moist. Her teeth look good, they're intact in good condition. Her tongue looks nice and pink and moist. Ayana, can you say ah? There you go. Thank you. Alright, thank you very much. So now I'm just doing a general appearance over her skin, and I'm going to assess Ayana's lung sounds now. I'm going to start with her anterior first. Could you take a breath in? Out. In. And out. I'm doing her right, middle, and left upper lobe. And normally I wouldn't listen to her lung sounds over her t-shirt. I would listen to skin if she was in a gown, and if she was in a gown, I wouldn't. I would just solely assess her lung sounds on her skin. All right, so now I'm just moving over. Scoot your arm out. I'm just checking her lung sounds laterally. Both sides. All right. All right, so now I'm gonna check her lung sounds posteriorly. I'm gonna move your hair. And as I stated previously, normally I would check her lung sounds skin. Take another deep breath in for me. All right, so all right, so now I'm going to assess Ayana's abdomen. I'm going to just check it and look at it first before I start to palpate. Ayana, you let me know if you have any questions, okay? All right, so I'm just going to palpate first before I listen. Ayana, what was your last bowel movement? Okay. So now I'm going to listen to her lung sounds in all 4 quadrants. Ayana has active bowel sounds in all 4 quadrants. So now I'm just going to check Ayana's skin over again. Her skin is dry. Everything looks good, nothing hurts.
No.
All right, I'm gonna check Ayana's capillary refill. All right, that looks good. All right, can you squeeze my hands? Thank you. She got strong grips for her hands. All right, and now I'm going to assess Ayana's radial pulse, her brachial pulse, and her pedal pulses. And they're all strong. Nothing's abnormal about those. So now, Ayana, can you press on my hands? I'm just checking Ayana's. All right, nice. She got strong foot grip too. All right, so now Ayana, I'm gonna have you just walk towards the kitchen. I'm assessing Ayana's gait. All right, that looks good. Okay, you can come back this way. So now I'm gonna assess Ayana's range of motion. Ayana, could you please just lift your arms up? All right, and back down. All right, and then lift your feet. One leg at a time. Thank you. Okay, so now you can come back towards me. All right, so now I'm gonna assess Ayana. I'm gonna assess her spine for scoliosis. So Ayana, I'm gonna have you just bend over. Be careful. I'm gonna have you bend over, and I'm just gonna look to check to see if there's any curvature of the spine. And Ayana's spine is nice and straight, and it isn't. Okay, thank you, Ayana. And Mom, do you have any questions, concerns right now? Okay, thank you. So, Ayana, do you have any questions or concerns right now?
No.
Actually, let me do one more thing. I'm going to test your skin turgor as well. You've been drinking a lot of water. It's been hot lately, have you?
Yeah.
Okay, good. All right, good. That looks good as well. Okay, so Ayana, if you don't have any questions, or if you do, let us know. Any concerns, let us know. If you don't have anything at this moment, we're going to document our findings, and then our physical assessment is over.
Okay.
Okay, thank you.